Hello everyone, I'm Dr. Beatrice Hyppolite and this is your world. How can menopause affect marriage, dating, or family relationships?
Really vastly. Vastly. Because in a marital relationship, a woman may feel, with this decrease in hormones and estrogen, that don't touch me. She might feel like, you know what, my libido is down to nothing. I don't want you touching me. Don't rub my knee. Get your hand off my shoulder, right? So that makes it difficult for a man who's in love with a woman and who's been laying in a bed next to a woman for a long time, for him to now have to climb into bed with this woman who doesn't even want to be touched. That's a blow. And if there's not a discussion that revolves around that change in her, naturally there's going to be breakdown within the relationship. How could there not be? Because there's not a clear communication as to what one is feeling, a validation of the other one's, what that person is feeling, and the coming together that they have to do in order to make it past whatever that current circumstance is. So in marital relationships, it has the potential to be a destroyer, because if you don't know how to properly identify, address, validate, and communicate what is needed for support, then you're setting yourself up for failure. And because a lot of people don't have that education, they're already on that path.
I'm glad that you mentioned the word education, because that's the key word there. So I know for many of us who may not have the knowledge or may not be in a position to explain exactly what is going on, but we all at some point go to the doctors. So will you recommend that for women and for both men and women, so who may be going through phases but don't really understand or cannot explain it fully or properly to their partners, can they take that partners with them at a medical visit? So where the doctor can fully explain to your partner, you know, hey, this is the stages, this is the phases. And so if you get to see this, you know, how to address it, how to respond to it.
Unfortunately, like we previously discussed, a lot of times women, their symptomatology is directed someplace else. The neurologist, the cardiologist, the therapist, all different kinds of people, before they actually are tested, their estrogen levels are tested. For men, it's almost immediate. They go in and they say, listen, doc, I can't, I can't perform. I can't perform. And then it becomes a quest to figure out how we can get you back up to your peak masculinity. And that even goes for like when a woman goes to a GYN. I've been experiencing hot flashes for the better part 6-7 years. I go to my GYN and I talk to, say, listen, this is what I've, and unless you really advocate for yourself, they're not doing a whole bunch of estrogen testing. They're like, it's part of life as a woman. They'll give you things to try and cope with the situation lightly on your own. You know what I mean? But there's not necessarily a whole bunch of diagnostics that are done, without a great deal of advocacy for yourself. Whereas men, they just got to say the word. And so going to a physician may or may not be, the first line of defense for a woman. Because the first line of defense, she's going to go into the doctor and she's going to say, I've been having palpitations, I've been having, headaches, I've been a little bit moody, having hot flashes. And they say, okay, well, that's, part of the thing. We'll monitor it for the next 6 months and we'll see. Until the woman gets to the point where she is able to get the testing that she needs, a lot of times that diagnosis is just kind of like, it's there, it's something you got to deal with. But for men, they tend to be much more proactive.
Okay, but in that case, so what advice will you give married couple?
I would say, again, respect, communication, and validation. Even if as a woman, you're not very well versed on menopause, Or if a man, you're not very well versed on andropause, whatever the symptoms are, those symptoms need to be able to be respectfully communicated to the partner. And once you start from there, then you can brainstorm as to what do we think the best way is for us to resolve whatever the situation is. Let's see, maybe, okay, you're saying that the intercourse is causing you pain. Maybe we look up things that are helpful that can reduce the pain. Not necessarily saying, and that's an education that you would experience together. You know what I'm saying? Not one-on-one, not one person by one person. They say, well, I'm having this and that's that. It's something that would have to be communicated between the two of you, respectfully. And then from there, the best plan of action would be to figure out what you could do to either mitigate the symptom or to quell the symptom or to a go around. But that's something that would need to be done together as a couple. So I think that's the take home. The take home is when it comes to those natural transitions in life, whether it be menopause or andropause, you have to be respectful of your partner. You have to listen to what it is that they're saying. You have to be able to communicate that you understand. Then you have to together figure out what you are going to do to solve the issue.
What can we do best to address the problem?
What can you do best to address the problem? If the problem is vaginal dryness and vaginal pain with intercourse, maybe a vaginal estrogen, because they have vaginal estrogen gels that you can put there and that can kind of, help alleviate some of the symptom. You know what I mean? But that's something that couples would benefit for more if they learn those things together. If they experience those things together, as opposed to the burden of everything trying to be like on the woman. How am I going to fix this for my husband? He wants to have sex and I'm just in pain. That's a burden for her to have to carry, which makes communication more difficult because she can't fully communicate if you're not going to be prepared to listen and respectfully communicate back and find the resolution to whatever the situation may be.
Okay. So very important, but I know there are people, going through those natural phases, so sometimes consider hormone replacement. So what do you think about that, and who can be the best candidates?
So people who should not be getting hormone replacement are people who have history of clotting disorders, people who have any forms of like a breast cancer or cervical cancer, like those kinds of things. But that's a decision that would be made between the doctor
and the
patient, respectfully, with the spouse in mind. Right? Because if you're going to be having these conversations, your spouse may say, oh, I see that there's a higher risk, with estrogen therapy for you to experience some sort of cancer. That husband might say, no, wife, I don't want you to take that risk. I'd rather just go without the sex. Do you see what I'm saying? Or the spouse may say, listen, risk it, girl. I need to, you know what I'm saying? But that's something that has to happen between the couples. It has to happen between what the doctor tells you based on your personal medical history. Every person is going to be different. Every woman experiences menopause differently. Some, like you said, you don't have the hot flashes and I do. Do you see what I'm saying? Every person has a different experience in it when it comes to that natural transition. And so it has to be very specifically oriented to whatever your medical history is and whatever the current symptomatology is. And then once you guys get together and figure out with the doctor what the best care plan is for you, then you go for it.
Will you say that there are some benefits to it?
Oh, absolutely. It can benefit people tremendously. But that's something that it's all because everyone experiences it differently. Everybody is going to experience the therapeutic remedies differently as well. You know what I mean? For some people, some medication may work with their hot flashes and other medications may not. It's going to be very specific to the individual who is experiencing the symptom.
Okay, that's good. So now we just, you just went over the hormone replacement. but they also have some practice that people can follow by not considering taking any hormone replacement. Lifestyle changes, exercise, proper nutrition, counseling, medications, and supplements.
Right.
What do you think about those?
I think anybody who's suffering anything, if there is something that is proven to help them, whether it be an exercise regimen, whether it be a change in your diet, whatever that is, if you are comfortable participating in those changes and it's beneficial to you, absolutely do it. Because you want to have a better quality of life. At the end of the day, what you're looking for is to have a decent quality of life. And if those symptoms are causing such stress within your day-to-day life, because you have to deal with it daily, right? If it's causing you a problem, if there's something out there that can help you, by goodness, do it. Do it. I would never protest anyone saying, oh, I want to go on a hormone therapy. Oh, I want to just change my diet and exercise routine. Oh, I just want to, whatever you think personally is going to help you and something that you and your partner are happy to deal with, then that's fine. And even if you don't have a partner, you know what I mean? Like it's really, like I said again, back to that individuality and what is going to make somebody more comfortable within their day-to-day life and give them the best possible outcome when it comes to quality of life.
Yeah, because it varies for many people, even for the food to avoid.
Right.
You know, so I may say, you know what, oh, avoid this type of food, but it may work for a group of people.
But the other people it doesn't work for.
It doesn't work for them again and again. So it's like everything. So you have to be in constant contact.
Right. Put all your irons in the fire.
So.
Put all your irons in the fire and see which one is getting hot. See which one is getting the job done.
And constantly having a conversation with your care provider.
Yep.
Because
about the different changes, what worked, what didn't work.
Yeah, so it's like, hey, we may say, you know what, avocado is a good food for when you experience it. It may be good for you and may not be good for me.
Right.
So, but so I may not be able to advise you on what type of food to consume because I don't know what may work for you. And it goes as well for vitamins. You know, some people may say, you know what, hey, stick on your calcium. Vitamin D, protein, fiber.
Right, and see the thing about those vitamins that are therapeutic for menopause. So in menopause, women lose a lot of bone density. Men lose bone density too, but then again, it's gradual. But for women, we lose our bone density. We're much more prone to bone breaks, fractures. We're much more prone to getting fractured, you know, the weak ankles, all those things. So that's why they say make sure you're getting your calcium in, because what they're doing is they're supporting your system so that if you fall, that added calcium is going to perhaps help you not to break a bone. They want to try, because they understand that you're losing bone density. And in order for us to replace that, you need the calcium. And with that goes like the vitamin D. Your body is not going to absorb one without the other. So that's why you see a lot of times your primary physician will say, oh, we're going to get you on vitamin D. A lot of women, part of their regular everyday daily medication is a vitamin D3, right? A lot of us, and we see it all the time. Oh, women, you should be taking your vitamin D. You should be taking your vitamin D, because they want to protect you from the long-term effects of that estrogen loss and the osteoporosis that comes with it, the joint pain that comes with it, the shoulder lock that comes with it, all the things that come with it. They want to be able to tell you that these are the supplements that can help you, right? Not necessarily going to change the outcome or the fact that you're losing estrogen or that your body system is actually changing based on that loss of estrogen, but to kind of support the things that you are losing.
Interesting.
Right.
Interesting. So in terms of exercise, so is there any specific one that you want to tap on, or?
So I'm not big on exercise personally. But from what I understand, strength training.
But you do a lot of exercise.
In the garden. I do a lot of garden stuff in the garden, but I don't have like an exercise regimen. Like I'm not getting on a treadmill. I'm not lifting weights or anything like that. But strength training is thought to be very helpful when it comes to menopause, andropause, because both of them, they're losing muscle mass for women, and they're both losing bone density. And so strength training is helping those muscles stay strong. You know what I mean? So that you're able to sit up upright, so that you're able to, if you are going to trip and fall, maybe you're able to balance yourself a little better because you have the strength. You don't just kaputs go down because you can't stand up. You know what I mean? So strength training is what I think is the go-to when it comes to exercising.
What about yoga and swimming?
What about my what?
Yoga and swimming.
Yeah, I mean, those two help with muscles. The yoga helps with balance tremendously, right? And we know when you have osteoporosis, if you do fall onto the ground, it is likely that you can break a bone. But if you're taking yoga regularly and your balance is top tier, maybe you take a trip and you're not hitting the ground because your body has trained itself to stay upright. Your body has trained itself to get in the downward facing dog. Your body has trained itself, and you have much more muscle strength to be able to keep yourself from falling on the floor. And with swimming is an exercise that uses all the muscles. You haven't been swimming in a long time, and you get in a pool and you start swimming, that next day you are sore because you have used every muscle there is in your body. So that's also kind of a strength training kind of thing, because you're exercising those muscles and you're keeping them active. And as long as you have some kind of activity that's helping you to strengthen the muscles, and you're taking the supplements that are going to help you assist with your bone density loss, then you're kind of like on a upward trajectory. You know, that's going to be what's the most beneficial thing for you to do when you are experiencing the symptoms of menopause and andropause.
Okay, thank you. Now let's go to stress management. Can stress make symptoms worse?
Yes.
In what way?
Yes. So as we know, cortisol is a humdinger. Increased cortisol levels prompt you to have more stress, more anxiety, all of those things. And when you're experiencing a decrease in the hormone of estrogen, the cortisol level is going up. Cortisol is increasing. So now here you are, you have this decreased estrogen, so now you got this brain fog going on, this joint pain going on, these hot flashes, the moodiness, and all those things, and your cortisol is naturally gonna rise. And that is the number one stress hormone. Your body gets stressed, the cortisol's coming. And that's a whole nother, those things, they work hands in hand.
Okay. We spoke about counseling, yoga, but some people say, journaling can be of assistance in that situation. I don't know if it is something you all agree on.
So let's say a woman doesn't have a partner,
okay,
or a man doesn't have a partner, and they want to be able to record what their symptoms are, what they were doing when they had these horrible hot flashes, what happened when they had this episode of complete brain fog, right? Sometimes that journaling can help you more easily express to your physician what is actually going on with you. And it might be a release for you too, because you can say to yourself, okay, so my day was horrible because I had all this stuff going on. Let me put it down on paper. That's kind of a way to self-release and to get a little venting, if you will, with the journaling, writing it all down, getting it out of here and putting onto there, right? But then you also have a document that you can take with you when you go to your physician and say, hey, on this day I had this going on this day I had that going on this day this is what was going on. And your doctor may be able to pinpoint and say, okay, well, what part of your ovulation stage were you in at that time? What time, was it within the last weeks, with the first couple weeks, or when was that happening? And they can see where you are experiencing the issue, what is going on, and that can bring you closer. Coming with that documentation can bring you closer to some kind of estrogen testing as a woman, because you have it written down. I got it all written down. This is what I've been going through.
Okay, so we know within that topic, there are facts and there are myths. Do you want to tap on them? What are facts and what are myths?
I think one of the myths is that every woman gets the hot flashes. Every woman has a decreased libido. Anytime you hear every or all, that's when you should throw a red flag up and say, you know what, maybe, because even like I said, not all men experience subtherapeutic testosterone levels with andropause. The other thing is that I think there was a lot of concern at one time about men who do take testosterone therapy and whether or not that's associated with increased risk for prostate cancer. And that has found not to be true.
To be sure.
Right, that has been found not to be true. So I think that sometimes even if a man is experiencing some symptoms, if it's in his best interest, and he and his doctor can decide upon whether or not he wants to take a hormone therapy, that's something like, again, an individual choice. Do you see what I'm saying? And I mean, I would hope that when people are experiencing any kinds of symptoms, whether they be from menopause or andropause, whether or not they have a partner, they have a healthcare provider that is going to, again, listen, try to understand, and try to resolve whatever the issue may be, man or woman, woman or man alike. That people have the courage, because it tends to be a taboo kind of subject. You know what I mean? For both men and women. A lot of times those personal kind of conversations, those personal things, a lot of people are not open enough to have those conversations with maybe their physician that they see for whatever other issues they may have. Sometimes people are just not comfortable having those conversations, which then again is a good time for that person to maybe journal, because then you can write those things down. You don't have to verbalize them, right? And it may be something that you want to have a discussion with your physician about, but you don't want to bring it up. So maybe you drop it off at the physician's office a day or two before. Have them put it in your chart. Maybe you want your physician to review what your thought process is before you even go in. So you don't have to, dryly come up with whatever your topic may be. But I would hope that people have the courage, and I would also hope that healthcare providers have the wherewithal and the know-how how to manage whatever symptomatology is coming their way, and how to properly direct that patient to the best possible outcome.
Another myth that I want to tap on, it's a belief that, menopause means that you're old.
No. Because, so even as we discussed the onset of symptomatology of a woman between her 30s and her 40s, that perimenopause can start during those periods, right? In your 30s, you're not old. You're not old. You may be having some decline in the hormone, but that doesn't mean that you're an old person. You can still move your body. You can still, and if you stay on top of everything as you age, which is a blessing. It's a blessing to age, right? It's something wonderful to gain more wisdom, to gain more experiences. As you age, if you are keeping up and trying to do the things that are going to decrease the effects that those hormonal changes are having on you, the better off you're going to be in the long run.
Okay, now let's address some medical questions. What symptom should never be ignored?
Palpitations.
Okay.
Anything that is tremendously impacting your day-to-day life. In women, a lot of times there are some genitourinary issues that happen with the onset of perimenopause and menopause, bladder issue, frequent urinary tract infection, just pain with urination sometimes frequency, you know what I mean? Not being able to hold the bladder, not being able to hold the urine. These are things that can happen during that perimenopausal state, right? Urine leakage, those kinds of things. Things that are really impacting your day-to-day life. If you're finding that you can't sit in a 10-minute meeting without getting up to go to the bathroom 2-3 times, you know what I mean? That's impacting the way that you have to live your daily life. If you feel that you can't, you work in a place that, doesn't have good air ventilation or whatever the case is, and you have to sit through work every day and you're having these hot flashes that are bringing you to panic, or you're having these hot flashes that are making you step away for frequent, multiple times throughout the course of the day, that's really impacting your day-to-day life. So if you're experiencing anything like that, that is a good indication that you should go and seek some medical help. You should say, hey, listen, I can't do my regular everyday thing now because I'm dealing with XYZ. Can we figure out a way to mitigate this symptom, or can we figure out a way to quell it altogether? What can be done? And the same thing with men. If they feel like something is impacting their day-to-day activities, then by all means, you should absolutely go and see a medical professional, because ultimately the goal is to maintain the best quality of life that you can. So anything that's infringing upon that, you need to address it.
Right away.
Right away, get rid of it. Do something about it. Be proactive about it. Yep.
Okay, very important. And my next question is are there warning signs of serious illnesses?
It can be either way. It can be. There could be an issue where for men, they have like hypogonadism. Their testosterone has gotten so low, that it creates real health problems for them. The same thing with women. The estrogen is so low that it's creating tremendous health problems, whether they be cardiac problems, whether they be orthopedic problems, whether they be other endocrine problems. There are a host of other things that, if gone untreated, right? Because the idea is that our body maintains homeostasis and then we start decreasing in these hormones. And as we decrease in these hormones, our body is changing. And if there are things that are changing that are going to affect us negatively, that are going to affect our cardiac health negatively, that are going to affect our kidney health negatively, that are the respiratory health, those are things that if you don't take care of them, they can turn into something that is going to be a lot more detrimental than just, the surface level symptoms that you may experience.
Okay, I know throughout the conversation we spoke about many things that menopause or andropause can cause. But does menopause increase dementia risk?
I want to say what I read was no, but I just want to verify that. Does not mean a person will develop dementia, right? That's what I thought. I thought the answer to that question was no. But what it does say is that estrogen changes and the brain function. Estrogen affects several brain processes, including communication, energy use, memory-related areas, and neurotransmitters. So while it's not necessarily a preemptive of dementia, there are a lot of, as you can see by looking at these things, that are closely related to dementia. So, you may not get dementia because you have menopause, but your dementia
both of them are
age-related. There may be some symptoms that they are closely mimic each other. But from here it says no. Menopause itself does not mean a person will develop dementia. Because there are lots of people who go through menopause and don't. There's lots of women who don't have dementia and they've gone through menopause, right? Because they've had 12 months or more without menstruation. So yeah, the answer would definitely be no, but I knew that there was some connection between the two and I couldn't quite pinpoint exactly what it is. That's why I wanted to refer to my notes. But there are a lot of the a lot of the brain processes that mimic each other very closely.
So now let's consider some cultural perspectives. Why are menopause and andropause are still considered taboo?
I think in a lot of cultures, sexuality in itself is taboo. You know, these are conversations that we're not having in front of children. These are conversations that some adults were not having these conversations in front of them because we know that they are not capable of having adult conversation based on the topic, right? So I think the only way that we can, as human beings, the only way that we can overcome that barrier is that constant communication, that constant education, and the opening it up. And as you know, as our children learn, our children are generally more able to discuss things that as adults we may not want to, we go, oh goodness, how are we going to discuss this thing? But as the generations are coming along, because like for instance, my grandmother's generation was the silent generation. You're not finding out anything from anybody. They're not talking about certain things. Everything is left best unsaid. You know what I mean?
And technology was not as prominent.
And technology was not as prominent. Now we live in an age of information. Mm-hmm. And a lot of information is useful and helpful to us. And the younger generations, they have their finger on the button. Mm-hmm. They are able to find that education, and they may be able to come to their parents and say, hey, Mom, I think that you are maybe experiencing some symptomatology of perimenopause, mm-hmm. And then that, as the generations go on, I think those conversations will become less taboo because there's so much now information about it.
Mm-hmm. It's very important. Our new generation, so it's like, hey, before we even know it, anything now, especially with AI, mm-hmm. AI,
the information is there. The information is there.
So,
and I think I even said in the last visit that I was here that when you want to do something, if you want to accomplish something, the only two things you need is the information and the resource. Mm-hmm. And then you can get it done. And the information is always right out there for you. That's it.
And one thing that I just hope is like for our young generation not to allow AI to take the intelligence of the brain.
Right.
It's a good tool.
It's a good tool to learn some information, but you have to have discernment. Exactly. You have to be able to have some kind of discernment, and you have to be able to have the ability to critically think. Because just because someone is saying something to you doesn't necessarily mean that that is what the case is. And if you can't critically think, it's very difficult then to have a discernment that's going to allow you to escape being completely engulfed in the alternative intelligence that we have here.
I've seen PJs waving. It's a sign to say, you know what, girls, call this show off. put an end, to it. So, but we're gonna do so. But before we do so, let's quickly go to the rapid fire questions.
Oh goodness, rapid fire, here we go. Let's see what you got.
One word answer, most misunderstood symptoms.
Mood.
Most overlooked symptoms.
The loss of bone density.
Okay. Biggest myth.
Everybody has hot flashes.
Most important vitamins.
Calcium, vitamin D.
Best exercise.
Strength training, strength exercises, things that are going to help you with maintaining muscle mass and maintaining bone density.
And most important advice.
Educate yourself.
Yes.
Get with your medical professional. Mm-hmm. Find out from them what you can do to help yourself work towards the best quality of life that you can have, whether you be a man or a woman.
Okay, now final advice. If you could leave our audience with only one message about menopause and andropause, what that would be?
My final piece of advice would be that it's something that we all experience. And with that being said, if you lead with humanity and you're respectful, of the person who is experiencing the symptoms, you will much likely be able to navigate yourself through whatever that transition period is for you, because this transition is going to be different for everyone. And so if you're leading with humanity when it comes to your partner, if you're leading with humanity even when it comes to yourself, because you have to give yourself grace as well, right? If you are leading with humanity in those instances, when it comes to that natural transition that happens in everybody's life, you're going to take care of yourself well. You're going to do the things that you need to do to give yourself the best possible outcome, the best possible quality of life, because that's what we're all striving for.
Thank you so much. You know how long I wanted to have a talk on that subject? So it's like I've been searching, all around. Even people who promised that they were gonna come cancel on me, change their mind. And I'm like, I know one day I'll make it happen.
Here I am.
I know one day I'll make it happen. And sure enough, because of you,
Thank you again for having me. Thank you for having me.
Thank you so much. And you know that you can come anytime. Whenever you have a hot topic, just call me. Hey, let's talk about that, and we'll make it happen. So before I let you go, I'll say this. Today's conversation reminds us of that menopause and andropause are not diseases. They are natural stages of life. With the right knowledge, medical guidance, healthy lifestyle choices, and emotional support, individuals can continue to thrive physically, mentally, emotionally, and spiritually. Aging is a privilege. Hormonal changes are a part of life, not the end of it. The more we educate ourselves, the less fear, shame, and stigma these transitions carry. To everyone who's listening, if you or someone you love is experiencing these changes, know that you are not alone. There is help, there is hope, and there are effective treatments available. Never suffer in silence, and never hesitate to seek professional medical advice when symptoms begin affecting your quality of life. Thank you to our wonderful guest, Nurse Taneesha Roberts, for sharing such valuable knowledge, and thank you for taking time off your busy life. I know you have a busy life. I know, the garden has to suffer today for you to be here. And for all of you who's been supporting the show since the day we started until today. So I thank you. All that said, I'll let you go. Please don't forget to subscribe. I'll see you next time.